Now, you are big on IV sedation. Why is that?
Honestly, I love it because my patients love it. You know, it's something that I've been able to do for them, and they love it. It makes it simple. I mean, a lot of these patients I have here, the before and afters that we've done, they're all been mostly done with IV sedation. Patients don't like going to the dentist because of the pain, the fear, the anxiety. IV sedation solves all that. The technology is there. We have that now to take care of that.
We talked in the green room, and oral sedation versus IV sedation. Most guys, I guess, are doing oral sedation. You like IV better. Why?
Look, I used to do the oral sedation. It works well. But you know what? The IV sedation is a lot better. I'll tell you why. Number one, it actually lets us give you more or less depending on what your body needs. Some patients need a little bit more. Some patients a little bit less. It all depends on how you're doing. So a lot of times when I'm doing an IV sedation, a patient will need a little bit more sedation. So with the IV, it's a lot faster. It's more controlled. We can get it more titrated. We can give it a little bit more, a little bit less.
Could you pull them out of it faster than the pill?
Absolutely, absolutely, yeah.
Okay. So you like IV sedation. And what are you monitoring when you're doing the IV sedation?
So it's very safe. I've had patients in their 90s getting this done. We're monitoring blood pressure, we're monitoring oxygen levels, we're monitoring heart rate, pulse, all of that. It's a very safe. We have all the technology in the room. We're certified. So I just had a patient the other day come to me. She said, "Doc, I went to a dentist. They tried to get me numb. They couldn't get me numb. It was a terrible, terrible situation."
Okay.
And she felt like she got tortured. I said to her, "Well, did you know I can do this with you for IV sedation?" She goes, "Really? You can do that?" I said, "Yeah, IV sedation." She goes, "You know what? I want to try that." And I said, "Because the IV sedation, you're sleeping. You don't feel anything. You don't remember anything. It's great for patients who have problems getting numb, or they just don't want to sit in the appointment for hours and hours to get multiple things
When
done."
you say you could do like 6 months worth of dentistry in one shot because of IV sedation, what do you mean when you say that?
I'll give you an example. I had a patient that needed a bunch of fillings done, crowns, they needed root canals done, they needed a whole bunch of work done. And for that, if he was just to get numb and go to the dentist and get numb, go back and forth, probably about 4 to 6 months, probably about 10 visits, we got it done in one visit. And you're probably asking yourself, well, how is this possible? How could you get all that work done in one visit? How is that possible? Well, the answer is simple. With IV sedation, the patient's sedated.
Okay.
They're in a relaxed state.
So they can hold their mouth open longer?
Yeah, they can. Well, we have something that we put in the mouth that helps them stay open, and they're sedated. And because they're sedated, their body's a lot more comfortable, relaxed. They're calm.
Blood pressure's lower?
Blood pressure's lower. Their body rate's going. It's kind of being in a situation where you're in a dream state.
Okay.